If your doctor told you your blood sugar is normal, you were probably relieved. But normal glucose levels don't always reflect what's really happening in your metabolism. And that misunderstanding may be why so many people develop metabolic problems without ever seeing a warning sign. As a practicing physician, I see patients every week whose blood sugar looks perfect on paper, yet their body is already struggling with insulin resistance quietly and invisibly. In this video, I am going to show you how doctors actually detect insulin resistance early, often years before diabetes, heart disease, or weight gain appear. And I will explain why most people are never tested, even when the warning signs are already there. Let's take a closer look at what those normal numbers may be hiding.
Let's start with something most people never realize. A fasting glucose test shows how much sugar is in your blood at one single moment in time, but it does not tell us how hard your body had to work to keep that number normal. In the early stages of insulin resistance, your pancreas compensates. It releases more and more insulin just to hold glucose steady. So, on paper, everything looks fine. Normal glucose, normal labs, reassurance. But beneath the surface, something else is happening. Insulin levels rise, fat storage increases, inflammation quietly builds, and the metabolic system begins operating under stress. This is why insulin resistance can exist for years, long before prediabetes, long before type 2 diabetes, and long before symptoms appear. Normal glucose can be misleading because it doesn't show the hidden cost your metabolism is paying. So, if glucose doesn't tell the full story, what do doctors look at instead?
This is where most people are never given the full picture. Ideally, this is where fasting insulin matters. Two people can walk into the clinic with the same fasting glucose, same number, same lab report, but behind the scenes, their bodies can be doing very different amounts of work. One person maintains normal glucose with a small amount of insulin. The other needs 2, 3, even 5 times more insulin to keep that same number stable. And from a medical standpoint, that higher insulin level is one of the earliest warning signs of insulin resistance. It tells us the metabolism is under strain long before blood sugar rises, long before prediabetes is diagnosed, and long before symptoms appear. And here is something important to understand. This insulin check is often missed, not because doctors don't care, but because fasting insulin is not routinely ordered in standard labs. So how do physicians actually measure it, and what numbers raise concern? We will now discuss how doctors check insulin levels next.
All right, here is where the numbers finally start talking to each other. Doctors don't just look at glucose, and they don't just look at insulin. We often combine them using a calculation called HOMA-IR, short for Homeostatic Model Assessment of Insulin Resistance. Think of it as a metabolic snapshot. It estimates how hard the body is working to keep blood sugar stable. When fasting glucose looks normal but fasting insulin is elevated, HOMA-IR helps reveal what's happening beneath the surface. In clinical practice, fasting insulin levels that rise into the upper single digits and beyond often signal early insulin resistance, even before glucose numbers change. And when the HOMA-IR calculation crosses commonly accepted thresholds, It strongly suggests reduced insulin sensitivity. This is the point where lifestyle changes, sometimes simple ones, can meaningfully reverse the trajectory. Because once glucose rises, the window for prevention becomes much narrower. This test helps reveal how much insulin the body must produce to control blood sugar.
Now, sometimes metabolism looks perfectly calm when the body is at rest, but problems often appear when the system is challenged. This is why physicians sometimes use an oral glucose tolerance test. It's simple. After fasting, a person drinks a measured glucose solution, and we watch how the body responds over time. In a healthy metabolic system, glucose rises. Insulin rises just enough to manage it, and then both return toward baseline. But in insulin resistance, the story changes. Insulin spikes higher than expected and stays elevated longer than it should, even when glucose levels appear acceptable. That delay recovery tells us the pancreas is working overtime, struggling to keep blood sugar under control. And this exaggerated insulin response is one of the clearest physiological signs that the metabolic system is under strain and deserves closer attention.
Okay, when glucose levels raise concern on routine testing, it's natural to ask a deeper question. How does glucose behave throughout the day? This is where continuous glucose monitors, or CGMs, come in. Much like a heart monitor reveals rhythm patterns, not just a single heartbeat, a CGM reveals glucose patterns over time. CGMs don't diagnose insulin resistance on their own, but they show how the body responds to meals, stress, activity, and sleep. They also allow us to observe 3 critical markers of metabolic health: average glucose levels, glucose variability, and overnight fasting trends. When glucose spikes frequently, stays elevated longer than expected, or recovers slowly after meals, it suggests reduced metabolic flexibility. And it's these patterns, not isolated numbers, that often reveal early metabolic strain.
I want to pause here because this part truly matters. Early insulin resistance is not a diagnosis of disease. It's a signal. And more importantly, it's an opportunity. When we identify insulin resistance early, often years before diabetes, it's frequently reversible, long before medication is ever needed. And this is where understanding your data becomes empowering. Now, connecting glucose patterns, insulin response, and lab trends with the 4 pillars of metabolic health: nutrition, movement, stress, and sleep, we can make targeted, realistic changes. You may notice certain foods consistently push glucose higher and choose to limit them. You may discover that something as simple as daily walk helps stabilize your glucose curves. These are small adjustments, but they create meaningful physiological change. I want you to understand that this video isn't medical advice. It's education, meant to help you ask better questions and understand what your standard labs may not be showing. And if you want to go deeper, I recently posted a video that walks through these lifestyle strategies in more detail.
There's one idea I want you to carry with you. Normal blood sugar does not always mean normal metabolic health. Insulin resistance often develops quietly, years before glucose numbers rise, years before a diagnosis is ever made. But when we know where to look, fasting insulin, HOMA-IR, glucose patterns over time, we can detect metabolic stress much earlier, and early detection changes everything. It gives you time, clarity, and the opportunity to intervene before disease develops.
If this video clarified something you have been wondering about, that's exactly why this channel exists. These videos are created to explain health before disease develops, clearly, calmly, and grounded in medical science. If that approach resonates with you, consider subscribing. I will see you in the next one.